Action for Health Justice for this webinar, which will focus on the recent funding opportunity announcement about the Navigator program. I'm going to introduce the speakers very shortly so that we can dive right in. But before we do that, just a couple of housekeeping items. One, everybody who is not a presenter is in mute and in listen-only mode. That's just to help reduce background noise throughout the presentations. And we will have a question and answer session that will be, but we will utilize that through the chat box. I'm sorry, not the chat box, the question box. So if you look on the right-hand side, you should see a box that allows you to ask questions for the panelists. And so I will be facilitating those as they come at the end of the presentations. So for today, we're really excited to be able to host 3 speakers who all are very knowledgeable about the Navigator program. The first speaker will be Gian Johnson, who has been with CSIO. CSIO is the Center for Consumer Insurance and Information Oversight at CMS. Gian has been there since October of 2010, first working on the Rate Review Grant Program and then joining the Customer Support Group in August 2012 to work on the Navigator program. Prior to joining CSIO, Gian attended undergrad and law school at the University of Oklahoma, and during law school, Gian worked on several healthcare advocacy nonprofits in the Baltimore and Washington, D.C. area, as well as in the Maryland Attorney General's office. Next, we'll hear from Jason Elkert, who is currently the Deputy Director of Ohio Association of Foodbank. In his current role, Jason oversees and directs all operations within the association, including the supervision of an annual organizational budget of about $20 million. His expertise is in organizational capacity building and public benefits policy. Prior to joining the association, he served for 3 years as an AmeriCorps Vista member. And then last but not least, we will hear from Michael Bune, who is currently the Executive Director of Asian Services in Action, a position he's held since 2009. Michael has worked for over 12 years on health disparities, social justice, and immigrant and refugee issues. He focuses on Asian American and Pacific Islander and other underserved communities and serves on the Ohio Governor's AAPI Advisory Council and the Board of Directors of the National Coalition of Asian Pacific American Community Development. And so without further ado, I want to hand it over to Gian.
Great, thank you. Good afternoon, everyone. I think someone else's slides are up, whoever's running the presentation. I'm not sure, maybe we should go in a different order.
Yeah, sorry about that. Jason, are you comfortable? Do you want to kick it off? And then we. Okay, thank you. Thanks, Gian.
Good afternoon or good morning, everyone, and I really appreciate the opportunity to talk with you all. So we are one of the largest Navigator grantees in the country, but also the largest in Ohio. And so just to give you a little bit of background about, if we can go to the next slide, about who we are, just so you kind of have a little bit of information about us. We are the largest charitable response to hunger in Ohio, and our main mission is to provide food and other resources to people in need and to pursue areas of common interest for the benefit of people in need. So we're really looking at how, not only how we feed folks, but then also how we bring additional resources to low and moderate income folks. And the Affordable Care Act is one of those ways that we're able to really not only help folks through the Medicaid process, but especially really trying to nail down affordable health care for them. Just to give you a little bit of additional background, we've worked with Michael and Asia and his team, probably for I want to say 5 or 6 years now. So we've been really familiar with each other over the years. So just so you have that kind of caveat with you, with what we're going to go through today. So if we can go ahead and go to the next slide, as my screen pops up. So we put together a consortium of partners across the state, because when we looked at the Navigator grant opportunity last year, one of the things we're very conscious of here is that we are not, we're based in Columbus, Ohio. So if we're going into other communities, or especially LEP communities, or just we have what I think of as kind of 5 different areas of the state that all think a little bit differently. And so what our job is to really think how we can bring services in the most effective way possible to various types of communities across the state. And so when we looked at the opportunity, we put together a coalition or a consortium of a wide variety of different organizations. And you can see on the screen in front of you, we've got everything from health access networks to Asia to some of the disability community to one of our food banks and the free clinics and community action organizations. So really just trying to grasp as many different types of organizations that we can really think about so that we're hitting kind of as many different populations as possible. So if we can go ahead and go to the next slide. So kind of, whenever I talk to folks, they're like, well, why the food bank network? And really what it is we have a very long history here at the association of being kind of that intermediary organization. We do provide grants to organizations throughout the year. Some are competitive, some are, in this case, we kind of worked with the various organizations that really had expertise and leadership in kind of working with various populations. So one of the reasons that we have this is that we are able, and we have the infrastructure in place to really manage large federal grants that do involve subgranting, that involve handling significant amounts of money, making sure all of the federal reporting is done and that we're all in compliance from an audit perspective and so forth. And we do this, and we've provided TANF tax grants to folks. We've granted AmeriCorps members. We provide food to 12 different food banks throughout the state and grant them different funding. So what we're kind of one of our expertise is really in taking that administrative role and handling it so that what we can do is really enable organizations that have expertise in working with various folks to do that and provide the best service that they can, so they're not really worrying about having to do all the administrative kind of on their end. So what we're trying to do is really make things as simple as possible. So if we can go ahead and go to the next slide. So kind of in thinking in terms of how we put this application together. So we did take the lead in putting the application together. And the way that we kind of, we did it is we provided simple budget templates to each organization that we chose to partner with. We provided them with a 2-page questionnaire that kind of went through the 5 functions of a navigator, which I know you'll hear about in a few minutes, and how their outreach programs would work. And additionally, how many navigators they would hire. Ohio is very much a county-based state. And then, again, how many folks they thought they could serve. So we're really trying to take it, not that organizations like yourselves don't have the capacity to do it, but if we can handle most of that, that just frees you all up to really think about how you're going to be able to provide the service and what's going to be your best outreach strategies and so forth. And that goes back to part of our one of our goals, which is to really make it as simple as possible and bring resources into communities. So then we took all of that information, we compiled all of that, and then we submitted as a group of community partners. And we came in under, there's varying different categories you can apply under, but we were, I think, the community-based organization partner. So we can go ahead and go to the next slide. So kind of thinking through some of the successes and struggles that we had. So one of them that we really did strive to achieve, and I think we were hugely successful in, was pulling together a wide variety of and types of organizations. Everything from working with Asia to working with the disability community to folks that might be eligible for Medicaid and how they're coming through the free clinics and so forth. But one of the reasons we reached out to Michael and his group is to really work with that limited English proficiency population. And, you know, we do have a language line available here at the association. But one of the issues where you run into, and I think Michael will explain this a little bit more in detail, are translating the insurance terms. And I think that was something that we all struggled with a little bit, whether it was through the CMS call center or our own language line, but just kind of working through what does all of this mean and how do you translate that down to the consumer level so that they're able to make a wise decision in which of the healthcare programs might be best for them. And so those were some of kind of our struggles as we even worked through it, was just thinking about how do we really provide the best service to a consumer that has some of those LAP issues, or maybe it comes from a different cultural perspective. And so that's one of the things that as part of the Navigator grant that you all can really bring to it. It's providing that cultural and linguistically appropriate services to the folks that you're serving. And that, I think, is a huge value. And I know that we relied on Michael and his team quite a bit as we thought about, you know, how we can provide the best outreach strategies to folks. So then we can go ahead to the next slide then. So we do have quite a bit of information if you want to check out our website. It's ohioforhealth.org, and that's where we were able to really provide organizations kind of, one, we did have a partner log into that website, which kind of had our standard operating procedures, frequently asked questions, reporting templates, so everything was in kind of a centralized location. But on the part that you all will be able to see if you log on, folks could request an appointment, they could request to participate in an event, they could request to host an event. So there are a lot of different ways that folks could be able to become involved, not only from an organization perspective, but also from the consumer perspective as well. And if we can go ahead to the next slide. So there are various ways that we can connect consumers with assistance, and I know, I think when Gian gets on, they'll be able to talk a little bit about this in more detail. So one was the in-person assistance through ohioforhealth.org, but then there was also self-serve enrollment available. Benefits.ohio.gov is our Medicaid system website, and so as there was a little bit of struggle in submitting Medicaid applications through the federal system, we did utilize benefits.ohio.gov as well as healthcare.gov. And so those were just two different ways that consumers could access through a self-serve environment. And then we also had a statewide, what we call our OBB hotline through one of our other programs, but we used it for the same purpose because it has some brand recognition. And that phone number, people could call in, they could get additional information, basically everything that you could do through our website. But it was, folks could call in and they could talk to a live person. And so thinking about things in terms of not everyone in Ohio has internet access. We don't have high speed and broadband in every part of the state. So just one more opportunity for folks to be able to talk to an individual. So, so we also provided that as well. And that hotline is connected to a language line as well. So I think if we can go to the next slide. If any of you have, I'm trying to keep my time limit here, if any of you have any additional questions, my phone number is there, and that's to my office, and usually the best way to get a hold of me is via email, because I'm not always at my desk all the time. So I think at this point I'm going to turn it back over to you.
Thanks so much, Jason. That was a really helpful overview. So I think the next presenter we're actually going to have is Michael. Michael, the floor is yours.
Thank you, and I have to apologize. I have a slight little emergency, so I'm doing double duty And I don't have the slides in front of me, so if someone could just kind of cue me that the slides have been forwarded, that would be great.
Okay.
If you can go to the next slide, the About Asia.
Yes.
Great. So again, thanks to Jason and his team at the Ohio Association Food Bank, we really have had a wonderful opportunity in this partnership as we work to address healthcare access for our communities in the state of Ohio. Just a little bit about our organization. ASIA was founded in '95 by 4 Asian immigrant women, and we're a comprehensive health and social service agency based in northeastern Ohio. If folks know Ohio geography, we're up north near Lake Erie, and the 2 major cities are Akron and Cleveland. Our organization's mission is twofold. We focus on empowerment and advocacy of our communities, but we also provide information that is culturally and linguistically tailored for our communities. Next slide. So our organization is really unique in the sense that we have these different programmatic areas, these 5 programmatic areas that are interconnected, and we offer services that are no wrong door. So anyone coming through any point of entry at our organization will have immediate access to programs and services throughout the organization. As you can see in this list, there were some specific highlighted sections in each of the program areas that are related to healthcare access and the provision of healthcare services. Recently, our organization became a federally qualified health center, a safety net health center for our communities. For over several years, we were documenting that our members of our communities in the Asiatown area of Cleveland were going to New York City for healthcare, and that was becoming an issue for our communities. And so as part of our organization's direction and board support, we've established a community health center to meet the unique language and cultural needs of our communities. The other thing I want to point out at the bottom in the cultural outreach portion, we have a very substantial interpreting and translation services program. That program supports the language access needs in each of our program areas. We also utilize this department as a social enterprise where we contract with health systems, courts, hospitals, and schools to provide language access services. Next slide. I just want to share this map with you to give you a better idea of the geography of Ohio and where we did our work. Jason had pointed out that we did work with the Ohio Association of Food Bank and the partners to provide language access, specifically in terms of materials translation and also consultation on just different strategies on how to address unique language cultural needs in the different communities that we've targeted. The work that we did in terms of language access for this particular project wasn't just isolated to Asian languages. Our interpreting and translation services provides languages in over 30 different dialects and languages that include non-Asian languages like Arabic, Russian, and Spanish. The stars delineate where, in addition to the translation services and the language access consultation, where we actually had on-site assisters. And this comes from our work over many years, I would say in some instances decades, with anchors, Pan-Asian anchor institutions and leaders within those specific cities around the state. So we had assisters in Columbus, Ohio, the central part of Ohio, and then also in Cincinnati area, which is down in the southwest region. And then our organization offered assisters, on-site assisters in multiple languages, including Karen, Chinese, Korean, and Nepali, which are some of the key languages of underserved communities in our area. Next slide. So here I wanted to just share different reflections on this work that we've done to give you some food for thought as you move forward and explore ways that you can serve your community with the ACA Navigator resources. I think one thing that Jason had highlighted initially that I want to re-emphasize is that Jason and OAS and Asia and I have had very good long-term relationships, and we've built that over years. And through that relationship, we've learned from each other and learned about the different communities that we serve and how to best serve them together. And so I think that's really critical, is that to explore and identify partners who you have good working relationship and build on that versus trying to establish a new one. Or if you haven't established any relationships but want to invest for the long term, identify potential partners now and start working with them on different projects so that you can build that relationship. We also did an inventory of the organization's capabilities and determined what we can or cannot do. Our organization, very similar to Jason's organization, have worked for many years in doing sub-grant or sub-recipient relationships with other ethnic-based and Pan-Asian organizations across the state of Ohio. That not only allowed us to build those trusting relationships and build that infrastructure with those respective organizations and communities, but also gave us the experience in managing complex contracts, whether they're federal contracts or state contracts. So that was a very important kind of asset of our organization. The other thing also is that our organization invested in public benefits access work for several years now, starting with the work that we did with the Ohio Association of Food Bank on the public benefits access work through the Ohio Benefits Bank. And that experience allowed us to be in a great position to work on enrollment in language for our communities. Lastly, I would just kind of highlight in terms of the languages covered. Certainly there are many, many languages spoken in the state of Ohio, but because of, in terms of resource limitations and need, we had to really prioritize. And working with the Ohio Association of Food Bank, we determined what those priority languages were and then focused our time and energy on those languages. As far as challenges are concerned, I would say coordination and training and support for partners across the state is very challenging, certainly because you are working in different areas. It's not easy to meet face-to-face, so a lot of the communication occurred on conference calls, and there are some limitations to that. We certainly did invest in terms of having our coordinator, Kathy Vu, who is phenomenal, going out to the different sites and doing on-site training and doing follow-up visits to make sure that our partners are well supported, and I think that's going to be really critical. And in certain states, that's easier said than done. I mean, if you're in a place like the state of California, working in an in-state exchange, that might be a little bit more challenging because of the geography and the distance. The other thing that I want to mention in terms of challenge is that de facto, as direct service providers, we are also advocates, and working closely with the Ohio Association of Food Bank and with also our national partners who are working on Asian American and Pacific Islander outreach and enrollment work, we've had to advocate and communicate with various federal agencies and individuals to help to ensure that access is there for our communities when it comes to the enrollment process. And there's been instances where we have submitted recommendations and suggestions on how to change things to improve language access as our communities who are limited English proficient attempt to enroll into eligible healthcare plans. So next slide. So as far as other reflections in terms of opportunities, I think, as I mentioned to you before, our organization recently became a federally qualified health center, and by providing the health insurance assistance as navigators, we have an opportunity, if we do not have access to a medical home, to provide one option to them as a possible place for them to receive care. And so that's a great linkage for our organization in terms of assisting them. The last thing that I would mention is that through our work, when there's been occasions where we've had excess capacity, that is, there's a lull in terms of enrollment activities on that particular day, we would lend our services to our other partners that are part of the collaborative and then attend and help them to enroll in their enrollment events. And so through that experience, we've really built the great relationships with our local health systems and social service agencies that know the work that we do and also are aware now of our language access services. So I think that was a very big, those two items are big positives for our organization. So last slide is So thank you so much, and then I think there'll be an opportunity at, later in this presentation for Q&A.
Yes, thank you. Thanks so much, Michael. Gian?
Great. Hi, everyone. Again, good afternoon and good morning. So I'm going to give an overview today. We can go to the next slide of the Navigator program in general, and then as well as our recent FOA that just went out. So the Navigator program was created by Section 1311I of the Affordable Care Act, and it requires marketplaces to establish a program under which Navigator grants are awarded. In the federally facilitated marketplace, this program is run by SOCIA under CMS. Navigators are required to perform 5 duties. These include conducting public education activities to raise awareness about the marketplace, facilitating selection of a QHP, providing information and services in a fair, accurate, and impartial manner, making referrals to other consumer assistance programs, and providing information in a manner that is culturally and linguistically appropriate. In addition to these duties, navigators are also required to conduct public education activities that create opportunities for individuals to enroll, as well as to participate in outreach events that are organized and sponsored by other community partners, as well as the CMS and HHS offices within their regions. This year we are asking Navigator applicants to more closely identify the geographic areas in which they plan to serve, specifically focusing on hard-to-reach and underserved individuals in those areas. So we can go to the next slide. This year, HHS is planning to award $60 million through our funding opportunity announcement. This will be divided similar to last year with a certain apportionment to each state that has a federally facilitated or state partnership marketplace. The minimum will once again be $600,000 per state. And following regulations, we will have at least 2 types of entities in each state, and one of which is required to be a community and consumer-focused nonprofit. We're definitely encouraging small entities and individuals to apply because we feel like these groups know their communities really well and how best to reach the consumers in those areas. The awards will also be structured as cooperative agreements again, which means there'll be substantial involvement and support from staff here at SOCIA to make sure that grantees are following their project plans and helping them out if they hit any bumps along the way. And these grants will once again, they'll be for a year. So the next slide. So as I mentioned, a couple updates that we made this year focus on having applicants provide a greater specificity in terms of how they propose to serve and interact with the individuals in their target community. This is to make sure that we have as many people on the ground that can provide face-to-face assistance as possible, especially I think with harder to reach communities. We recognize the value of human contact and helping folks get through a process that they're not entirely comfortable with. We're also asking applicants to provide a list of the partner organizations that they'll be working with and the number of consumers they expect to reach, as well as including a plan for providing language accessibility options and the list of counties that they will be serving. Additional information to also think about including in your application, outreach plans, other ideas for hiring and training, and how you plan to reach different enrollment goals along the way. So the next slide. For the FOA this year, we are requiring a letter of intent, and this is due June 30th into the Navigator Grants inbox, and all the information for this is in our funding opportunity announcement. All applicants that want to have their applications reviewed will need to submit a letter of intent. Applications are due on July 10th, and they're due by 1 p.m. Eastern Standard Time. This year, we've raised the point scale to 200 possible points, and we are aiming we have a much more greater breakdown of the points within each category. So if you're interested in applying, definitely take a close look at the FOA, and you can see how the points are structured for the different areas that we're looking for applicants to speak to. This funding is open both to, we have current Navigator grantees, but we're also welcoming new folks to come aboard. Next slide, please. And so then just kind of an overview of the process. After applications are received, they will be distributed and reviewed by members of our Objective Review Committee, which is they're outside folks who are qualified and unbiased, and they will review and score all applications. And then the results of their review will be used by us at HHS to approve and make our final award decisions. We're planning to announce awards September 8th of this year. The next slide. And then in our recent regulations, I wanted to flag that we have some additional requirements that focus especially on language access. Navigators specifically must develop and maintain a general knowledge about the racial, ethnic, and cultural groups in their service area. They are required to collect and maintain updated information to help understand the composition of the communities in their service area. We're asking them to provide consumers with information and assistance in the consumer's preferred language to the best of their ability. They should provide oral or written notice to consumers who have limited English proficiency. And we are encouraging navigators to receive ongoing education and training specifically focused on language access. And lastly, we're encouraging navigators to implement strategies to help recruit, support, and promote staff that are representative of the demographics and characteristics in the areas that they're working. And a discussion of these factors and how an applicant would comply with them is also part of the scoring criteria in the FOA. And then the last slide. This is just an update, a reminder again of the important dates, and then the website at the bottom is our website where you can find some FAQs if you're interested in applying, as well as the link to the FOA. We have one more pre-application call. It's a Q&A and a webinar, and it'll be next Tuesday at 1:30 Eastern Standard Time. So if you're interested and haven't joined, we've had 3 so far, but we'll have one more. And any additional questions can be sent to the Navigator Grants inbox, which is navigatorgrants@cms.hhs.gov. Thank you.
Great. Thanks so much, Gian. And thanks to all of the presenters, especially for staying on time. So we have lots of time for Q&A, and actually they're starting to really come in. So first off, I think this question is directed at you, Michael. The question, two-part question is, how many navigators did you use to target the AAPI community for enrollment, and also what your metrics were during the first open enrollment period? How many people did you reach and enroll? Do you have that information?
I have some, yeah, I can give some information on that. So as far as navigators, and this is a little bit kind of misleading because we, for example, in our area up in Cleveland and Akron, we had, I believe, a total of 6 who were certified as navigators. And that does not mean that we had 6 full-time navigators. Our organization has a very unique strategy in terms of our program benefits access assistance folks are generalists. So they are trained on multiple public benefits areas, including enrollment in the health insurance exchange and the Medicaid enrollment. So in terms of the total number of assisters up in Cleveland, I believe we had 6. We had also less than half time for Columbus, and then another less than half time in the Cincinnati area. As far as the total number enrolled, I believe our numbers as of the most recent say names was 1,400, and maybe Jason could help me with that if he has that number handy, but I believe it was 1,400 total where we assisted as far as helping with enrollment. That's in-person assistance.
Mm-hmm. Thank you, Michael.
And that number sounds correct, Michael.
Great. So the next question looks like is geared towards you, Gian. It's kind of some clarifying questions about the grant and the LOI. So with the LOI, do you have to list all of the organizations that you intend to partner with, or do you only need to submit the LOI with the name of the organization applying? And I'm assuming the lead organization in this instance.
Sure. So the lead organization should definitely be listed, and to the extent that you know partner organizations, you can definitely list them. But if those change or if you don't know those right now, it's completely fine to just submit the letter with only the lead organization.
Okay. Thank you. And then also, is there a maximum length for the LOI?
No, it can actually be just a sentence in the body of an email stating your organization name, your intent to apply, and the point of contact. It can also be a letter, but lots of flexibility. If additional information, I guess you can find on page 20 of the FOA.
Great. And just to double check, the deadline for the LOI is June 30th?
Yes, that's correct.
Okay. Is that 5 p.m. Eastern Time?
We are just any time on June 30th, so we'll give folks until like 11:59 Eastern Standard Time.
Great. Thank you. And then we have a few questions asking whether the slides will be available after the webinar. I forgot to mention this webinar is being recorded, and so that includes both the slides and the audio. All the presenters have agreed to that. So yes, that information will be available after today's call. And then, let's see, moving on to the next question, are there ways for smaller CBOs to be subcontractors, if they cannot carry out all of the activities required of navigators? So for example, could a CBO do just the public education activity and receive funding from a navigator to conduct those activities?
Yes, so Navigator grantees are allowed to both partner with organizations, and their partner organizations have to do all of the Navigator duties, but they're also allowed to subcontract, so hire out just for additional assistance with outreach or additional IT support. So for organizations that aren't interested or able to do all of the functions, that may be a good alternative approach as well.
Mm-hmm. Jason, is that something that you all encountered at the food bank as well? Was that a strategy?
Yeah. What we did is, we made it really clear, we're going into the application process that we would really have to perform all 5 functions. And, that's one of the things we just kept hitting back and forth, although we also relied on the expertise for some of the special areas, like I think the 5th function, if I'm correct, on the cultural linguistically appropriate. That's where we relied on folks like Asia to really take a lead. So kind of each of us had a kind of various lead, but we did all work through all 5 functions.
Got it. Thank you. The next question looks like it's for you again, Gian. What is the approximate length of time that's needed for somebody to become certified as a navigator?
So on the federal level, they'll need to complete, it's a 20 hours of a web-based training and then a final exam at the end. Different states also have training and certification requirements, and we're encouraging applicants to reach out to the state departments of insurance within their state to see what additional training hours are required on that piece.
And is the federal training component, the 20 hours, so you mentioned that's online, does that have to be completed by a certain time?
No, it's going to be self-paced, and so staff can take it as they're being hired. It does need to be completed before they begin working and assisting consumers, but it can be taken 24 hours a day, just depending on schedules.
Okay, great. So it doesn't have to be done before they apply?
No, yeah, definitely. No one needs to worry about completing any of the state or federal training prior to submitting an application. We'll provide more information on training to awardees after awards are announced.
Great, thank you. That's helpful. Let's see, the next question is, I think, directed to you, Jason. Can you share some talking points with some of the community-based organizations who are represented on this call, and give them some tips on, what are some ways they could do, what are some things they can say or ways they can approach larger organizations to become partners or sub-grantees with Navigators, and can you also kind of speak more about the value of partnership with small CBOs?
Yeah, so I'll address the second part first. I mean, I think I said this a little bit in my presentation, but we are not, here at the association at least, experts on every community and every part of the state. And partnering with small community-based organizations is one of the most valuable things I think we can really do. You all know your community best. You can talk to them, how they really like to be talked with. You're trusted entities, and I think that's one of the most, in going to the first part of the question, that you can really respond to larger organizations that, may be applying, is that you do bring that value, because as one of the 5 functions is going back to that providing cultural and linguistically appropriate services. And that's where Michael and his group, through our partnership over the years, we've relied very heavily on them in reaching this community. And I think when you're looking at talking points, I think one of the things that, for us, it was very easy to go to Michael because we've known each other for so long. But I think one of the things that you can do is really think about, and I think this list has been published a couple of times, who has applied for Navigator grants in each of your states. And I don't know, they may have contacted their Department of Insurance, so that might be another resource to go and figure out who all is doing that work in your state. But I think one of the talking points and tips is just that you are a trusted messenger and that you are a resource that that organization can be a part of. And it may not be where you want to do the entire Navigator function, but you might be able to be a contractor of that Navigator grantee that can provide some of the translation services, that can be one of the messengers in your community where you can distribute materials and so forth. So there's a lot of different ways that folks can participate as part of this program and provide those resources to your community. But I think it goes back to being that trusted messenger in your area.
Thank you, Jason. That makes a lot of sense. So another question, I think would be really for anybody. But Michael, during your presentation, you talked about how Asia was able to do outreach to LEP communities and different populations. We're wondering if there are other examples outside of Ohio, perhaps, of how Navigator grantees have partnered with local communities to reach limited English proficient populations.
Oh, honestly, I don't know what, well, I know that there are those that weren't necessarily funded through the federal ACA Navigator resources, where they have, provided language access services for enrollment. But I believe those organizations did those on their own and did not necessarily partner with a larger mainstream effort. So I'm afraid I don't have any other examples. I can tell you a number of examples of community-based organizations that directly received some resources through various funding streams that are non-federal, where they have engaged in not necessarily Navigator assistance, but through the CAC process, which is the Certified Application Counselor process, have CAC designation to members in their organization who are able to provide assistance to those who need help.
Mm-hmm. Mm-hmm. Thanks, Michael. And actually, that I'm glad you brought up the CACs. I think, if I remember correctly from last year, the CAC program didn't really kind of launch and get started until, I think, after the funding opportunity announcement for the last Navigator grant. So, you know, thinking about how CACs can work together with Navigators in the drafting of the grants and proposals, and which it wasn't quite up last year, and thinking about the role that CACs played during the open enrollment period and how critical they actually were, even though they did not receive Navigator funding or federal funding. You know, are there some tips or some ways, creative ways, that any of you or suggestions that any of you can share with folks on the call about how to integrate CACs into their Navigator grant proposals?
Well, in our case, we were able to leverage some additional non-federal dollars for our outreach and enrollment effort, and that allowed us a greater level of flexibility in terms of working with smaller community-based organizations who may not necessarily have the human resources to go through the training that's required, but can go through the shorter CAC training to be certified that way. And that provided another branch for us to outreach. So it was a very important outreach arm that if there are instances where the CAC cannot necessarily assist that individual because the case is a little bit more complex, then they can forward that to our assisters who are navigators, certified navigators. So that's been an important strategy. So I would encourage folks on this call, as you evaluate this federal funding opportunity, not only locally or nationally, there are a great amount of interest in ensuring that we do assist folks to become insured with this new opportunity available through the Affordable Care Act. And so for that reason, there are local foundations and national level efforts to assist local communities. So there's additional funding streams that I think you folks can explore, and I'm sure there are conversations occurring throughout your communities. So I would encourage you folks to kind of dig deep into your community and talk to different folks and see who else is working on this project.
Mm-hmm. Thank you, Michael. So we're on our last question. So just a reminder, if others want to ask any additional questions, please type them into the question box. Gian, I think this is for you. Can someone apply more than once? So for example, an organization applies on their own as a navigator, and then they apply as part of a larger consortium.
Yes, that's a great question. Applicants are definitely able to apply multiple times or as part of multiple applications. The one thing that we ask is that when you're writing your applications, you ensure you write them as though you could receive both awards. And so in allocating time to each application, you would need to make sure that total you're not budgeting more than a full-time or one FTE of time for activities. So 50% in one application, 50% in the other.
Okay, that's good to know. Thank you. Great. And we just got a bunch of more questions. Another So this is an interesting question. It'd be actually interesting, I think, especially for Jason and Michael, to get your perspectives. So there's been mention about these quote-unquote larger organizations serving as the lead and really taking on the administrative responsibilities. This person is asking, I guess is trying to weigh, the pros and cons of whether to be a subgrantee or to be whether it might be better for them to serve as the lead organization, and so the question is around, what is the analysis that this organization should take in terms of assessing whether they are quote-unquote large enough to serve as a lead organization or whether they should attach themselves to another group that's even larger than they are.
Michael, I don't know if you want to respond first or I can. I think it really depends on what you have the capacity to do within your organization. One thing that we are very conscious of here is making sure as much money gets out the door to folks like Michael as humanly possible. So we're very conscientious of that. We don't take administrative dollars on the grant, and we don't, one of the things that we were able to do, I think that was really cost effective, was do as much large purchasing of media for the whole group that we could, just trying to save on costs so that we could put as much money into people as we could. And Michael, I don't know if you want to talk about from your perspective at least.
Yeah. So I think Ohio is a very unique case, and the way that OAF has approached this is a very unique way in that they're very much concerned about ensuring that the resources get to the communities affected, and so we really appreciate their leadership in that way. And I know that in some other states and other communities, that's not the case. Certainly, you have territorial issues. There are organizations that have very limited experience or kind of comfort with large-scale collaborations, and so certainly that's a challenge. So one thing that I would do if I was an organization that had good potential to become a lead, again, I would say you would have to do the internal analysis that Jason had suggested. But apart from that, if you think that if you have good confidence and that you think you could be competitive, I would propose that, again, there's that public list of the Navigator grantees across the different states, and the ones that are on that list are likely to apply for this. I would approach them and let them know that you may consider applying, just as kind of a way to let them know that, we may consider applying as a lead. And I think, if anything, that starts a conversation where you can then put on the table what you can offer, and perhaps there will be opportunity to negotiate to ensure that you're included in their proposal. So that's one potential kind of David-Goliath strategy, I would call it, that you might want to explore. Again, I don't know the political landscape in your respective communities, but sometimes if you might need to kind of exercise that confidence a bit to at least to get the conversation started in communities or organizations and regions to understand that this element of Navigator work, the language access and the cultural competency, is extremely critical. They emphasize and they make note of that in the guidelines. And if you're able to bring to the table that perspective and support and resources, I think you have a really good chance of at least getting some resources to support your community.
Thank you. We have a couple more questions, so let me throw them out, and hopefully we can get some of your feedback from the panelists. So the first question is about the reporting requirements, and it's a two-part question. One is, what was the reporting process like for the Navigator agency? So Jason, you might be in a good position to answer that, or Gian, if you want to talk about the requirements. And then also, what in particular, how many individuals at your agency were actually responsible for fulfilling those reporting requirements?
Yeah, so the reporting was done, I want to say, we had, at one point we were doing weekly metrics, which were for internal use at CMS and SOCIO. And then we also did monthly reporting as well, so that we could just kind of keep an eye on where we were at, because we're an organization that understands, the data equals dollars. And so if we can keep that data moving and really understand where things are at, then we're able to continue to provide even more technical assistance and get into different areas of the communities. And then we also submitted quarterly reports to SOCIO and some of the reporting were the number of indirect contacts, the number of individuals that you talked with that required multiple Navigator sessions, and then how many folks you actually enrolled, and then down to, I think, which of the top 5 qualified health plans in the state were being selected. And so what we did is created an online Google survey for all of our partners to utilize that then rolled that information up on a monthly basis. So.
Okay, thank you. Michael or Gian, do you have any comments on this, on the reporting?
No, well, just in terms of structure for next year, it's going to be very similar. We're going to be requiring weekly, monthly, and then quarterly in a final report with similar metrics as last year, but a couple changes to have kind of more detailed information and capturing the work that navigators do outside of actual enrollment.
Okay. And then we'll end with one last question. It's a data question. Do any of the panelists know if there's a website that contains data or statistics for number of uninsured residents in each state that's also broken down by demographics like racial and ethnic, population, and county? Does that exist?
I know the number of uninsured by geographic area does. I'm not sure if it's broken down by demographics. But one of the websites I think that we found really helpful, I'm just trying to find it, is I want to say it's, let me check here before I say anything. It's countyhealthrankings.org, which does use some of the small area health insurance estimates from the Census Bureau. And it does provide the number of uninsured adults and children by county. So that's a website that you can use as well.
That's helpful. County Health, what was it that again?
Countyhealthrankings.org.
Countyhealthrankings.org. Got it. And for those of you who are part of the Health Forum's ACA cohort, I believe our research and data team had also put those profiles together last summer, broken down by the county in terms of AA and NHPI population overall and uninsured, and I think LEP. So if you want to get back in touch with either myself or Bonnie or Marianne, we can dig those back up for you. Okay, with that, thank you so much for the really informative call. As I mentioned, we have recorded it, so we will, since there's a demand for the slides and viewing, we will post it and send the link out to everybody who has participated and RSVP'd. Thanks so much. Have a great rest of the day.